Thank you, Senator Klobuchar. I recognize the distinguished gentlelady from Vermont, Ms. Balint, for 5 minutes.
Thank you so much. Thank you, Ranking Member Raskin, and thank you, Senator Durbin, for pulling us together today. And certainly a special thank you for all of you. We know how busy you are, and we really appreciate you being here today. I want to focus my remarks building on what others have said about the Trump administration's attack on science. And facts and science still matter. They still matter to Americans. Supporting scientific research has to continue to be a national priority. And some things have to exist outside of the political partisan debate. And one of those things, of course, medical research, right? Scientific advancement, an area where we have been a world leader. But that's not going to continue to be the case under this administration if it continues to attack the scientific community. So as we discussed a little bit earlier, you see this administration attempting to illegally slash research grant funding that we appropriated, that Congress appropriated. And from what I can tell, Trump is doing this for two main reasons. One, he claims that research that is being done is too woke, which I think is a cover for that he doesn't actually understand the research. Either way, his administration continues to ignore the experts, and he fundamentally doesn't believe in making the necessary investments in our national scientific research. And this administration continues to nickel and dime scientists. And of course, this puts us all in a very dangerous situation. Our status as the leading nation in the world for science is being severely threatened right now. We see researchers and scientists deciding to leave our country and go overseas, which is a reverse of what happened during World War II when people came here because this was the safe place to do research. You have a situation where we, of course, will not benefit from this. Our constituents won't benefit from it, but the world won't benefit from it. And ultimately, I don't want Republicans in my doctor's office, and I really do not want them in the science lab either. So we have to continue these public investments, and these grants and cuts are irrational, and they conflict with the will of Congress. But as you spoke to, it's not just the will of Congress, it's the will of the people. It's what Americans want us to be doing with our money. And so your individual and collective work matters. I don't think that any of us feel like we're fighting as much as we need to in this moment because it's so grave. We're working as hard as we can, but I want you to know what you're doing does matter, and we see it, and it gives us courage to keep fighting. And so if I could start with Attorney General Campbell. Massachusetts obviously is the center of so much research. You've been on the front lines of pushing back against these hurtful and, as I said, illogical cuts to NIH. I'd love for you to talk a little bit about the strategies that the Trump administration is using to slow or cancel grant funding. What should we be looking for? What can we be doing to fight back as well?
Well, thank you, Representative, and I have to lift up your colleague, A.G. Clark, who we all work with very closely, and my husband's from Vermont. My mother-in-law is still there. So.
Oh, represent! I didn't know that.
So
right.
She's 86, young and fabulous. So I didn't know I'd be able to give her a shout out. So hello, Mimi. So in all seriousness, NIH too, I think, speaks a little bit to your question, and grateful for Illinois, but AG, the state of Illinois, but AG Raoul for just continued partnership, because what we heard is post the first lawsuit where we challenged the indirect cost issue, which on a Friday night they said they were just going to cut in indirect costs. And Massachusetts gets billions. I think in fiscal year 2024, we got over $300 billion just in that one fiscal year. So immediately mobilized, one, to remind the public what indirect cost means. It's the laboratory itself, it's the human capital, it's the equipment. You can't do research without all of that, even though the administration would have people think otherwise. Yeah. So one on that, but then what they attempted to do was manipulate the response from the court in many ways and cut grant meetings. They had gone through the scoring process with so many institutions that have gone through this process for years. And once you go through a scoring process, for example, you then have an expectation based on previous conduct by the administration that you will show up and have meeting number 1 or meeting number 2, guaranteeing that you will get a certain amount of money, which then informs your budget.
Of course.
So the meetings were canceled, or grants that were already contracted or promised were suddenly under threat, or canceled, or they were threatening to cancel those grants. So we went back into court on NIH 2 and just recently won that, which is significant because it is not only indicative of what we can do as AGs collectively in response to grant funding, where they directly cut it off, but also where they're playing games to threaten that funding. It's also a huge victory. So we will see what will continue to happen going forward, but we'll continue to think outside the box based on what we hear from institutions on the ground on how we can respond legally. And then, of course, through our engagement with the lawyers from the DOJ in these cases, also push them to do their part in turning on sources of funding or to maintain them.
I mean, you spoke to a really important point that gets lost in all of this, which is that science involves incredible planning.
Right.
Obviously,
Years of it.
right? Exactly, years. I know I'm short on time. I do want to just ask you if you could just speak to just the impact that these cuts have on regular people. Why should Americans care so deeply about these cuts to these research programs?
Well, I will say, and almost lift up what was said before, it's one, we're talking about life-saving treatment for almost every disease you can think about. And if you find yourself in a situation where your doctor has diagnosed you, for example, with cancer, or your child with pediatric cancer, I would hope that you would want your medical institutions to do everything they could, offer you all the care they could to be able to save you or your child's life. And when you have an institution, a Trump administration and their respective institutions seek to intentionally cut this funding overnight, it causes life and death situations for us on the ground. But it also, in addition to that, it creates jobs. I mentioned the healthcare institutions earlier in Massachusetts. Healthcare institutions, higher ed institutions, even tech companies. The foundation in many ways of our economy in Massachusetts, of our international standing in the world, is now undermined because of these cuts. And then lastly, which can't be discounted, is our global standing. What A.G. Raoul said earlier about the advancements that we make here in this country, in Massachusetts and beyond, to advance clinical research, leading and cutting edge research to solve the most pressing diseases where we hope in the next generation we're all gone, they are gone. Critical in not only what will come, but also, as A.G. Raoul mentioned earlier, this ability to craft new medicines and new responses to some of the same diseases that will save more lives. So I will never understand why they targeted and continue to target science, public health, NIH, the Science Foundation funding, or others, but know that you have AGs who are here and others who are not, who will stand up to continue to fight.
Thank you so much for all you're doing. And, you know, I just want to say that we all have to continue to find ways to communicate more clearly to Americans about what is happening right now. Because I know people are exhausted and checking out because they're so overwhelmed. So you being here matters. It gives us another opportunity to highlight the importance of it.
Thank you,
So
Ms.
thank you so
Balint.
much.
Thank you so much.